Hey everyone, my name is Dr. Tyler Kaye from Medina Sports and Family Chiropractic. Today we're going to talk about posture. I had a lot of people come in worried about their posture, thinking that's why they're in pain, and asking if we can help with that. So today we're going to go over a bunch of information. I'm going to give you some research studies that tells you pretty much like the myths about posture. So here's the myths that we're going to be covering. Biggest one is we have to live in perfect posture, sitting up nice and straight, chest out, relaxed shoulders. You can see right now I'm not even sitting that, I'm slouching down. Bad posture leads to poor health, poor outcomes, and bad posture puts stress on anatomical structures that result in degeneration and pain or other pathology in the spine. And then you have your little buzz terms like text neck and slouching, stuff like that. So what the research says, the first one, I'm going to go over the entire summary at the end. So pretty much all this research, I have about 5 papers that I'm just going to share with you. These are all ones that I've read or are commonly reviewed. So the second one right here, thoracic and lumbar posture behavior and sitting tasks and standing. Pretty much they go through differences between men and women for sitting and standing and seeing if there's any correlation between different postures and pain outcomes, range of motion, stuff like that. And there were 0 differences. There was no difference in outcomes at all. This third one right here is consistent lordosis. So lordosis is the extension in the spine. So sitting up nice and straight like this, getting that curve in your back. So they measured sitting in lordosis and sitting in kyphosis, which is opposite, slouching. And they tried to find a difference if sitting in perfect posture was more beneficial or not. And the outcome was no, there was no difference in sitting posture. Physiotherapists' perceptions of optimal sitting and standing postures. Again, they're just going through different types of postures, seeing if there's a difference in kyphosis, flexion, or lordosis extension. Again, no correlation between posture and pain. And then this last one kind of goes through that buzzword text neck. And you can read down here. The text neck, they measured all these medical school students who complained of pain and logged their hours on their phone. And they found that there was no correlation between kids who had pain and time spent on phone. So text neck is kind of like a buzzword that a lot of health professionals like to use, but it's actually no correlation between the text neck and posture and pain, anything like that. So I always tell my patients where you're kind of getting in trouble is not so much the posture that you're in, but the lack of movement that you're doing. So if you're sitting like this for 8 hours a day and not moving whatsoever, you're going to have pain. If you're going to sit up nice and straight, sit in perfect posture for 8 hours a day, not moving, you're going to have pain and you're still going to be stiff. So what we're going to do is go from here for about like 30 seconds and then go right back to where you're comfortable working. And then do that for about an hour, a couple hours, whenever you feel stiff, and then go right back into like a perfect posture or maybe like a side, whatever one to just change. That way you're getting the movement. Not so much, I'm not really worried about the specific posture. I just want you to move a little bit more. So pretty much the conclusions are your asymmetries are going to be normal. So you might have one shoulder higher than the other. That's totally normal. Your body can tolerate these asymmetries without loss of function or development of pathologies. So it's not going to cause further degeneration or pathologies just because your shoulder is like 1 millimeter higher. Doesn't matter. Pathology does not determine symptoms. So if we were to take I have a whole PowerPoint on this as well that we're going to go through. If you get an x-ray or anything like that and you see degeneration, that doesn't determine that's the cause of your symptoms. And like I said, that'll be a whole other PowerPoint. There's no relationship between postures and back pain. I hope I made that clear already with this. And correcting all these postures is pretty much impossible. They're not we can't fix all of them. It'll be unattainable. And if we were even to do that, the outcomes obviously would not change because we also went through all of that as well. So I hope this helps answer a bunch of questions. If you have any other questions, please come see us. And if you want to know what we actually do for people who are just tight and work from home, come on in and see us, Medina Sports Family Chiropractic on right behind Staples in Medina on Pro Road, or give us a call. So I hope this helped. Thank you.